Hello everybody, Dr. Jeff Lynch here with McKinney and this is Dental Implant Talk. Today I'm going to answer the question, are dental implants safe? Well, the simple answer to that is yes. Getting a dental implant is a safe procedure, and it's a very beneficial one. So I'm going to talk about the potential complications that go along with that, but first I want to talk about the benefits and why somebody would want to replace a missing tooth with a dental implant. So first, why do people lose teeth? Well, big cavities that can't be restored, serious infections, cracks and fractures that'll make the tooth so we can't fix it. And sometimes people need something done to a tooth and they just can't afford it at that time and they opt to have it taken out. So what are the effects of losing a tooth and not replacing it? Well, it affects the function. It decreases your chewing efficiency. Number two, it affects the stability because the teeth around it are going to start shifting into that space, and that is going to throw your bite off even more. It affects the aesthetics. Obviously, a gap in your smile, it's going to make it so you're not going to be as likely to smile big or laugh out loud, at least not with confidence and not affecting your self-esteem. And all of these things add up to negative effect on your quality of life. They're all going to affect you on a day-to-day basis. Now, people are missing teeth and they get used to it, but the reality is it's always there and it's always affecting them. Replacing a missing tooth with a dental implant solves all of those problems. Now, dental implants do carry a small risk of complications, pretty much the same as any other oral surgery procedure. Mostly those are related to infection or pain and swelling. When we do an implant procedure, we always place a person on antibiotics just to make sure. Ice and pressure will help keep down and minimize the swelling. Usually with an implant procedure, from a pain standpoint, a Tylenol and Advil combination is all is needed to keep people comfortable. Now, there are times in more advanced procedures where we're doing significant bone grafting where there's going to be more discomfort than others. And with the bigger procedures, there's a slightly greater risk of infection. But we do what we can with medications. And as long as a person is relatively healthy and they follow our instructions, the incidence of post-op complications are very rare, and that makes this a very safe procedure and the best way to replace a missing tooth. Hope that answers your question. Look forward to meeting you at McKinney